Gynecology. Now, oh my goodness, what is that thing in there? I got stuck in the cervix for a second. We have cascading cervices here. Ceviche. Oh, it is a part of the waltz. Dun, dun, dun. Shall we dance? Yes, it is cervical emotional tenderness. A woman comes with lower abdominal pain and fever, fever and lower abdominal pain and fever, and tenderness on the exam as we give that thing a twisty, twisty, twisty. You know, there isn't really a way to demonstrate cervical motion tenderness because it hurts. It's just something that you see when you have what? Pelvic inflammatory disease or ectopic pregnancy, pelvic inflammatory ectopic pregnancy, tubo-ovarian abscess. So the first thing always to do with lower abdominal tenderness in any person, sexually active woman, sexual age. Don't even ask about sexual activity. I don't ask about sexual activity. Hey, are you sexually active? And they're like, no, not at all. What do you mean? No, I just lie there. I'm not active. So the answer is that cervical motion tenderness, don't ask about it. The first thing to do is, since the most rapid, which of these is going to kill you the fastest? The one that kills you the soonest is ectopic ruptured pregnancy. So any woman with lower abdominal pain gets a pregnancy test first, then nucleic acid amplification. Culture E is for gonorrhea. Nucleic acid amplification testing can be done for both gonorrhea and chlamydia. This, as a single test, is a fantastic way of seeing what organism is in there, because you're multiplying the genetic material. What you're doing is you're multiplying the genetic material to see what you can see. Gonorrhea, chlamydia. Cervical motion tenderness. But the most accurate test is laparoscopy. Now, I didn't say we do it. Laparoscopy is like tympanocentesis for otitis media. Do we do it? Not really. In other words, if you treat them and they don't get better, and you treat them and they don't get better, and you treat them and they don't get better, then you can do it because you want to see, are you really sure about the diagnosis? Or if it recurs and recurs and recurs and recurs and recurs, then you can see whether there is something in there with laparoscopy. Now, if a pregnancy test is positive, then we're going to do a pelvic sonogram to say, where is the ectopic? But if the sono doesn't show the pregnancy, transvaginal ultrasound is the test to see, hey, you're pregnant, but I couldn't see it with a sono. Transvaginal sono. Hey, what about endocarditis? Well, you have endocarditis. I think you got endocarditis, but transthoracic echo is negative. What do? Transesophageal. Oh. So what do you do if transthoracic echo is negative? Transesophageal. What do you do if pelvic sonogram negative? Transvaginal. What do you do if the PSA is positive, but I can't feel it with a rectal exam? Transrectal ultrasound. You got the idea, man? Ooh, I think you've got Zollinger-Ellison syndrome, but I can't find the gastronoma with a sonogram or a CT. Endoscopic ultrasound goes deeper inside. Look for that pregnancy test first. And remember, nucleic amplification test is the same test you do on a man for the urine to see if he's got gonorrhea and chlamydia on his urine. It's the same test on the cervix and on a urethra, which is to say urethritis. Ooh, my head's in a speculum, sorry. What is that? Ooh, tasty, isn't it? Makes me feel like, is that a strawberry? It is. It's a strawberry cervix. It goes on top of chocolate agar, which is Thayer Martin medium. This is cervicitis. Ooh, ceviche. So these are white cells surrounded by gonorrhea. Gonorrhea, gonorrhea, let it flow. These are white cells, polymorphonuclear leukocytes, PMNs, and this is gonorrhea, gram-negative diplococci. So Neisseria gonorrhea is a fastidious, motile twitching. Who's that? Sounds like us. I'm fastidious, motile, and twitching. You're fastidious, motile, and twitching. So now oxidase positive is part of the microbiology of this. Chocolate agar, oxidase positive, chocolate agar or Thayer Martin medium is because Neisseria is a very picky eater. The Neisseria is like, I'm not growing on just anything. I'm special. I live inside your urethra. I live on your cervix. I'm not breathing just regular oxygen. I want 5% carbon dioxide. And I don't eat anything. I don't eat blood like those disgusting streptococcus. I eat only chocolate. And you've got to kill off the competition, because if I see any other organisms, you are going to just kill me. So you've got to kill off the other competition. The gram-positives get killed off with the vancomycin. Nystatin kills off the fungus. Trimethoprim is given in such high doses as to kill off the gram-negatives. Same with the colistin. Kills off the gram-negatives. Between the vanco for gram-positives, nystatin for the fungus, colistin and trimethoprim for the gram-negatives, basically it kills off the competition so the Neisseria will grow. And this is not random that you see Neisseria gram-negative red, gram-negative red, gram-negative red, gram-negative red inside a neutrophil. Gram-negative red inside a neutrophil on a gram stain. Chocolate agar with antibiotics, 5% carbon dioxide, or nucleic acid amplification testing as a DNA probe. Ooh, a type 4 pili. What are you doing with that type 4 pili? Did you know that the type 4 pilus is one of the strongest muscles there are in anything to attach you to surfaces? It can lift 100,000 times its own weight. A type 4 pilus can lift 100,000 times its own weight. 100,000 times. How strong. Wow. Look at that. Aren't they beautiful? Gram-negative diplococci. Here's those pili. Oh yes, it pulls into you. Yeah, and that's how it grabs onto your cervix and your urethra and grabs it and pulls it in. Wow. Cervicitis is seen here on the speculum. That's a strawberry cervix. Gram stain, which we saw with the gram-negative diplococci inside. Nucleic acid amplification testing. What is the most accurate test for Neisseria is the culture. Purulent discharge, which is the saying pus. Pussy discharge, which is purulent discharge. Cervicitis is most often caused by gonorrhea and chlamydia. And what you see is that you go ahead and treat it. Ceftriaxone and azithromycin. Ceftriaxone, doxycycline. Now you might be saying confusedly, is DNA probe or the culture the single most accurate? As one test, DNA probe, which is the same thing as saying nucleic acid amplification testing, is the single most accurate test. But for culture is the only way that you can determine the sensitivity of the bug. And that's only for the Neisseria. So for Neisseria, the test that tells sensitivity is the culture, because you can't get sensitivity off the DNA probe. And the urine testing is for urethritis. That's more in men. They pee into a cup. So the most specific test, most specific, is for gonorrhea, is the culture, because it allows sensitivity testing. Now, what is it? This is a normal nippy? That's an abnormal. That's nipple retraction. What is it? Nipple retraction is indicative of cancer. And you need mammography and a biopsy. Mammography and a biopsy to make that determination. Because you see, what happens is that when the cancer's inside the breast, it retracts and pulls the ligaments. There's actually ligaments attached to the nipple on the inside. And the ligaments of the breast actually pull the nipple inside, so it can actually retract that nipple. And you can see, because cancers in breast, that adenocarcinoma is rocky and tight and fibrotic, and actually tightens up tissue, shortens it. And that's why it can actually pull the nipple in, nipple retraction. Now, if you're looking at the physical findings that we have in the set, you can be pretty sure that if it's not here, there's very little that's significant that's not in this set. As a matter of fact, we have, you know, I mean, when you're going to see a picture of clubbing and a picture of a cleft palate, you'd be like, well, what's that? Well, it's clubbing and cleft palate. And that's because you'd be stunned to think, really? There's only like 200 physical findings? Actually, there's about 190, 195 meaningful ones. There's not an endless amount. You see, when you're at your level, you think it's an endless amount. But it's not. that retraction pulled in with breast cancer, because normally a breast is freely mobile on suspensory ligaments. However, the ligaments pull in breast cancer and shorten the breast inside. Okay? So this is from shortening of those suspensory ligaments, and you'd have to do a mammography and a biopsy, and you're done. Here we go. Here is the breast, and here's how you do mammography to find out what's inside. Mammography starting at age 50 for sure, maybe at 40. You'll see that in the diagnostic test cards. It's short, but you know what? You deserve a short section. See you soon.